Good afternoon, everyone. Welcome to our LAMP webinar. We will now call on Ma'am Mildred Digma to start the ball rolling with her lecture on blood. Good afternoon, Ma'am Mildred.
Good afternoon po, Doc. Good afternoon po muli mga classmate. Muli po pagpapatuloy natin ang ating topic, ang sweat or blood, number 12. Red tongues with kidney yin deficiency. The common result of kidney yin deficiency is development of heat from deficiency, which over a long period of time will dry fluids and injure blood. So pag yung matagal na po yung heat, na-apekto na po yung ating blood. When this occurs, tongue appears red and dry with little coating. So yung pag matagal na, nawawala na po yung coating. The stronger the heat, the greater the injury to blood and fluids, which in turn leads to redder and drier tongue body. Symptoms associated with kidney deficiency with heat. So pag kidney deficiency po, ito ang mayroon siyang tinnitus. Pag gabi po ay nagna-night sweat. Tapos mainit ang kanyang palm and sole. Yung mouth is dry at may flushed face po siya. Namumula-mula. Unconstrained heat, smoldering fire or fire toxin can develop. Extremely red tongue covered with a yellow coating. So yun po yung makikita natin sa tongue. Sobrang pula. Tapos yellow yung coating. Symptoms associated po, pwede siyang may fever. At napaka-irritable po niya, madaling magalit. Yung kanyang mouth is dry and throat. Tapos uhawin siya at meron siyang mouth ulcers. Heat and fire are capable of injuring blood and blood vessels. So nagkakaroon po ng spontaneous bleeding. Kaya yung mga nagdudugo po, madaling magdugo ng matagal, yun, lalo po sa mga menstruation. Possible po yan may heat. So heat in the blood, yun nga, nagkakaroon ng excessive menstrual bleeding. Red po, tapos makati ang kanilang mga skin. May mga nagkakaroon ng skin lesion. Tapos general feeling of heat in the body. In this case, so yung tongue body po niya ay talagang completely red, deeper red or scarlet red. Pag tinignan po natin, red na red. So to evaluate origin, degree, intensity of heat or fire, and resulting injury to yin and fluids. So yung practitioner po kailang i-observe, hindi lang po yung intensity ng kulay, ng dila, but also yung shape po at saka coating. Heat generated by deficient yin that smolders for a long time in the body, yung matagal na, and then become uncontrollable will affect essence. Yung pati yung essence po ay maapekto na pag matagal nang mainit yung katawan. This energetic deficiency can be developed over course of year or be accelerated by serious illness. So nagkakaroon po ng sudden collapse of yin, which thereby allows siyang to rise uncontrollably. So pag mababa na po yung yin, syempre yung yang po ay tataas siya ngayon. Kaya puro po init ang nararamdaman. Burning out syndrome. So mildest expression of this energetic imbalance is sudden loss of hearing. Yun, nawawalan na, nabibingi na po. While its most severe form is nagkakaroon ng cerebral stroke. So matinding init po yung nasa katawan pala ng may mga cerebral stroke. In some cases, yung burning out syndrome, often followed by nervous breakdown, is subjected to same pathology. A good visual image for what happened energetically is candle burning at both ends. So yun po yung itsura. So kaya dapat talaga nag-acupuncture tayo. So candle wax is substance, yin and essence, while the flame corresponds to yang. Ay, para pong kandila, no? At the end, pag nawala na po yung wax at natunaw na, so there is a short intense flickering of the flame excessive yang. Yung pag natutunaw na siya, nako-consume nung init, ganun din po yung nangyayari sa katawan natin. Yung example. So outward blazing, fire in the body, vent itself in myocardial infarction. So po yan, yung stroke, yung hypertensive crisis, or uncontrollable bleeding. So yung tongue body is red, dry, contracted, or stiff. Yung matitigas na yung dila. The heat has injured fluids and yin so severely that muscles, so pag na-injured na yung fluid po, yung muscle na apektuhan, yung sinew, yung tendons, including those of the tongue. So become malnourished na po siya. So this condition can cause internal movement of wind. Kaya minsan pag pinalabas na natin yung dila, yung gumagalaw po yung dila, nakita natin na talagang may wind dahil sa heat, nagkakaroon ng wind. So deep red discoloration of tongue also arises when heat enters nutritive and blood levels. So this pathology can produce a soft red tongue, indicating malnourishment of sinews. Yung mga ano po natin, mga ugat. And tendons due to extreme heat. Yan. Patient with this tongue type often suffer from hemiplegia, yung following stroke, or from atrophy disorder. The soft red tongue is unfavorable prognostic sign. So, hindi po siya magandang sign. Ito po yung ating case. Tingnan natin. Male, 33 years old po siya. Tongue description, deep red, especially in the center. Wide shape, deep red tip, whitish slippery coating at side, dirty yellow coating at the center. So yung symptoms po niya ay may severe heartburns, stomach pain, insomnia, nightmares, inner restlessness, panic attack, excessive sexual drive. So yung Western diagnosis, wala po. So yung background po ng disease, excessive use of alcohol, coffee, and nicotine. Tapos yung excessive masturbation. Diba sabi natin nakaka-injure nga yun ng Jing essence. TCM diagnosis po ay kidney deficiency with stomach fire. Nakita natin doon sa tongue, yung mga red talaga. Internal heat and toxin due to alcohol. Tapos yun, may heat and heart fire, yung dulo po ng dila na napaka-red. Long-standing accumulation of phlegm fire. So, for heat po yung sign. Okay, thank you po.
Thank you very much, Ma'am Mildred. I'm sure maraming natutunan yung ating attendees. Okay. Okay, so to sustain the enthusiasm, let's continue with tongue diagnosis with Ma'am Teresita Sumile. Good afternoon, Ma'am Teresita.
Good afternoon po, Dr. Hector and classmates. Welcome to tongue diagnosis. And now let's talk about pale and narrow tongues. Pale, slightly swollen, narrow tongue bodies may indicate deficiency of blood and improper circulation of liver qi. The narrow tongue will look slightly contracted. This type of tongue arises from deficiency of spin qi that lacks strength to circulate qi and produce blood. The consequence can be insufficient supply of qi and blood to the channels, collaterals, muscles, leading to weakness of pain in the extremities. In rare cases, only one side of tongue is contracted or drawn in. This change suggests liver qi constraint and lack of liver blood flow since the sides of the tongue reflect the circulation of liver and gallbladder qi. Pain or sense of weakness along liver or gallbladder channels can be manifestation of this pathology. This is a common tongue sign, particularly in women who suffer from breast diseases. The contracted side of the tongue does not always correspond to the side of the affected breasts. Now let's go to our patient, female, 37 years old. Tongue description, pale, slightly pale, swollen with teeth marks, narrow on both sides and drawn in. Ang symptoms po niya ay pain in the left thigh and shoulder and migraines with sensitivity to light during menstruation. Western diagnosis is organized hematoma in the thigh. Then background to disease, overwork, side effect of contraceptive pill. TCM diagnosis, we have spleen-chi deficiency with liver blood deficiency and liver chi constraint, possibly blood stasis. Okay. Next is a female, 28 years old. Tongue description, slightly pale, swollen, drawn in on both sides, as we can see in the tongue picture. Then symptoms presented by the patient are pain in the right arm and shoulders, tingling and numbness of the thumb, and then muscular tension and ringing noise in the right ear. Western diagnosis, brachial plexus neuropathy. Then background to disease is whiplash. TCM diagnosis are spleen-chi deficiency with liver blood deficiency and lack of nourishment of sinews and tendons due to chi and blood deficiency. Okay. The next is female, 38 years old. As we can see in the tongue picture, the tongue is pale, strongly drawn in, especially on the left side. Symptoms presented by the patient are weight loss, fatigue, swollen axillary lymph nodes, and then pain under the right hypochondrium. Western diagnosis, bilateral breast cancer and liver metastasis. Background to disease, suppressed anger and overwork. Then TCM diagnosis are spleen-chi deficiency with blood deficiency, then liver chi constraint and liver blood stasis. Patient died 1 year after this photo was taken. Sad naman. Okay, yan lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. Next, we will have diagnosis by interrogation. And let's welcome Ma'am Vina Pasqua of Baguio. Good afternoon, Ma'am Vina.
Good afternoon po, Doctor. Good afternoon po sa lahat. So, mental emotional symptoms. Day 10 na po tayo at ang topic natin po ay worry. Karamihan po sa mga patients complain of propensity to worry and overthinking o kaya pensiveness. And even if it is not the presenting condition, maraming tao ang nagpo-profess to it when pag tinatanong. Ang emotion po ng worry is related to the lungs. Lungs po ba or stomach and spleen? Ang lungs po kasi sadness and grief. And overthinking, pensiveness is more related to the spleen. So worry describes a condition in which the patient is prone to imagining the worst possible outcome in a certain situation. Gaya po halimbawa, yung nanay imagines that yung anak niya has been in an accident when he is late arriving home. So nakaka-relate ako sa worry. Overthinking describes a state in which the patient is unable to empty the mind of repetitive thoughts, which may be of relatively trivial nature. Molehills may become mountains in their minds when an apparently insignificant issue. Ito Itong propensity to worry and overthinking is most commonly caused by and may in turn cause an empty condition. A deficiency of spleen G o kaya blood is the most commonly seen pattern, leading to worry and overthinking. However po, yung heart o kaya yung liver and or liver blood deficiency may also lead to yung sobra po yung pag-worry na. May mga sitwasyon din na excuse me, in which overthinking is caused by a mixed or full condition, namely stagnation of lung qi or yin deficiency and empty heat. So worry from a full condition is usually more intense and consuming than that from an empty condition, which a patient may describe as being more lurking in the background. So ito po yung summary, worry and overthinking. Ito po yung patterns niya. Heart and spleen qi deficiency. So nag-worry, slightly obsessive thinking, slight depression, overthinking, pale po ang dila at saka empty pulse. Pag lung qi deficiency naman, worry, depression, pale tongue at saka empty po ang puso. Then next ay lung qi stagnation, worry, mild irritability, depression, a feeling of lump in the throat, tongue slightly red on the sides in the chest areas. Ang puso po very slightly tight on the right front position. Pag heart blood deficiency naman, nag-worry siya, depression, pale and thin tongue, choppy or fine pulse. Pag liver blood deficiency, so nag-worry pa rin, which increases after a period in women. At pale po ang kanilang dila, choppy or fine ang kanyang puso. Sa heart yin deficiency, worry, insomnia, dream, disturbed sleep, poor memory, anxiety, propensity to be startled, madaling magulat, mental restlessness, uneasiness, feeling hot and bothered. So, ang puso po ay floating empty, especially on the left front position. Heart deficiency with empty heat, worry, especially in the evening, anxiety, propensity to be startled, mental restlessness, uneasiness, feeling hot and bothered, pula po yung dila, rather on the tip. Kasi nga, sa heart, no coating, floating empty at rapid pulse. Yan lang po. Thank you, Doctor. Thank you sa lahat.
Thank you very much, Ma'am Vina. Next, we go to pulse diagnosis. Let's welcome again Ma'am Mildred Tigma. Good afternoon, Ma'am Mildred.
Good afternoon po. Pagpapatuloy po natin ang ating pag-aaral sa pulso, pulse diagnosis, number 93, superficial pulses. Ito po yung empty pulse, sumay. This pulse is also translated as vacuous and deficient, similar to drum skin. Naalala po natin kanina yung drum skin. The empty pulse is superficial and wide. So yun po yung drum skin. But the difference between the two is that empty pulse is not hard and the pulse is without force. So the empty pulse's weakness is reflective of deficiency condition. So if the pulse is also rapid, it will be a manifestation of yin deficiency or heat. Pulse can also be seen where there is Jing deficiency or Qi deficiency, or if a person has been invaded by exogenous summer heat that has endured Jing and Yin. If there is an invasion of summer heat, the pulse will be rapid. So yung empty pulse po, ang pattern of imbalance ay kung yin deficient po, yin shu, sue or blood deficiency, qi shu or qi deficiency, and jing shu. So yung typical combination po ay pwede po siyang empty and rapid pulse. So yung po ay yin shu or yin deficiency, heat or summer heat. Next po is hollow pulse, HOMI. This pulse is often translated as a scallion stalk pulse. This pulse, like an empty pulse, is superficial and without strength. So, superficial po without strength. The difference between the two is that when you push down to the middle level, so pag diniin mo po sa middle, lampas po sa balat, ang hollow pulse po ay nawawala. Hindi mo na mararamdaman. This is disagreement in the text about what happened if you push further down to the depth level. Some books write that you will feel the pulse again at the deepest level. Others that you will not. Sabi doon sa ibang libro, pwede daw maramdaman pag diniinan mo pa sa deepest level. Pero yung iba naman hindi. Some also state that the edge of the pulse can be felt clearly when you roll your fingers back and forth across the pulse. The reason that the pulse is called a scallion stalk is that it feels like a stem of spring onions. O, para daw po yung yung spring onion. If you put your fingertips on the scallion stalk, it will feel around and wide but also frail and without strength. In the center, if it of it and void will be felt when you press harder to the scallion stalk. So yun, nadi-differentiate na po natin Okay. The middle level of the pulse reflect the condition of blood and the stomach and spleen. An emptiness in the middle level will therefore be interpreted as more as severe deficiency condition than if there was an empty pulse that was not empty in the middle level. So yung po ito pong hollow pulse ay, ang pattern of imbalance po niya ay yin-shu or yin deficiency, sue-su or blood deficiency, chi-shu, and jing-shu. So yung typical combination po ay hollow, ay maaari po siyang hollow and rapid pulse. So yin-shu heat, yin deficiency heat, or summer heat. Ito naman pong scattered pulse. This pulse is superficial. So, superficial po natin nararamdaman. Wide and without strength. Pag pinatong natin ang kamay natin, mararamdaman natin ang scattered pulse. Malawak, pero wala siyang lakas. Tapos, pag diniinan mo, nawawala na rin. So, yun po yung scattered pulse. The difference between this and a hollow pulse is that yung hollow pulse po ay clearly defined boundaries when the fingers are rolled back and forth. So this is not the case with the scattered pulse. The edges of the vessel are not defined, making them difficult to perceive. The pulse is so feeble that it disappears with the slightest touch. Masosha described the sensation as being like a lot of small dots below the fingertips instead of wave. So yun po sabi ni Masosha, pag scattered pulse ang iyong kinakapa. Yung scattered pulse po ay arises in the same situation as the drum skin's pulse. The difference between them is that yung scattered pulse po, the loss of chi means. Kasi yung drum skin, loss of blood. So pag scattered pang naramdaman natin, chi po yung wala. Loss of chi. That the walls of the vessel lack chi, and this can be felt by the lack of clear definition. The diagnostic significance of the two pulses is therefore almost identical, but with the difference that in scattered pulse, the loss of chi is greater. So, ma-differentiate na po natin drum skin, loss of blood. Scattered, loss of chi. Scattered pulse, pattern of imbalance, yin-shu, sue-su, chi-shu, and jing-shu. Okay po, thank you.
Thank you very much, Ma'am Mildred. So from pulse diagnosis, lipat tayo sa differential diagnosis foundations. This will be presented by Ma'am Needs. You is currently enjoying your vacation in. Good afternoon, Ma'am.
Good afternoon, Doc Hector and everyone. How's my audio, Doc? Okay lang?
Okay lang po.
Hello?
Thank you.
Okay. Hindi naman maingay? Sorry po, medyo maingay. Lakasan ko na lang.
Hindi maingay.
Hindi, okay.
Na ano niya yung noise. Thank you.
Okay. Thank you. Today in our TCM Foundations, number 194 is another pattern in the lungs. Water cold in the lungs. Okay. Etiology, exterior invasion of wind cold. When patient suffers from phlegm or water swelling, para namamaga sa tubig. Two pathogens combining to impair diffusion of lung qi. Lung qi deficiency, stomach deficiency, kidney deficiency can also underlie. Okay? Possible presenting condition. You can see here in severe cases sa mga pulmonary TB. Okay. Sign and symptoms, cough, hasty panting with inability to lie down, and puffy swelling of the lower limbs. Copious, thin white phlegm, fullness and oppression in the chest and rib side, distension and fullness in the abdomen, cold pain in lumbar region, cold knees and lower legs, and scant urine. Okay? Pulse when you palpate is tight and floating or tight and wiry. Tongue, when you see the tongue, is mayroong thin fur or thin coating. Its color is white and glossy or sometimes, or white and slimy. So, parang may phlegm din. Treatment principle, warm lung and transform phlegm, assist young and disinhibit water. Okay, acupuncture treatments. These points, to warm the lung and transform phlegm, you have to select from here. Bladder 13, lung 9, stomach 40, LI 4, REN 12, stomach 36, and REN 17, CV 17 po yan. And these points to assist the young and disinhibit water, you have to select from here, REN 9, REN 6, bladder 23, bladder 20, bladder 22, and spleen 9. Thank you very much, everyone. Thank you po.
Thank you very much, Ma'am Needs. Next is acupuncture patterns and practice. We will continue with the discussion of dizziness and vertigo. Clinical manifestation. Vertigo may begin abruptly or gradually. In mild cases, there is only blurring of vision, heaviness in the head with lightness in the feet, or a rocking, swaying sensation. So this will tend to stop upon closing the eyes, pag mild. But in severe cases, the sensation is like that of being seasick or carsick, and the outside world revolving about incessantly. This may lead to falling down. Common accompanying symptoms include tinnitus, eye irritation, insomnia, forgetfulness, weakness and aching in the waist and knees, nausea and vomiting, pallid complexion, or sweating with cold limbs. Vertigo tends to attack repeatedly, but the interval between attack varies unpredictably. Many patients have it every few months or years, but some have it several times a month. During an attack, the tongue coating is mostly white and greasy, or yellow and greasy. During remission, tongue coating is thin and white, so bumabalik sa normal. The tongue is red or is speckled with petechiae or purpura. The pulse is usually taut but may be thread-like and feeble. Key points of analysis. Vertigo mainly arises in a state of deficiency. Basic mechanism, deficiency of liver or kidney yin, or deficiency of qi and blood. In yin deficiency, the tongue is red with scant coating. Pulse is taut and rapid. In qi and blood deficiency, tongue is pale and tender, and the pulse thread-like and weak. The state of deficiency may be complicated by stirring of endogenous wind, flaming up of fire, blockage by turbid phlegm, or by blood stasis. So we have to differentiate these conditions carefully. These are related to dysfunction of the viscera, principally the liver, spleen, kidney. In disturbance of the liver by passions, the liver qi is pent up, and this will transform into fire. Or in deficiency of liver yin, liver yang may become hyperactive. Either can induce vertigo accompanied by distending headache and flushed face. If the spleen fails to generate and transform qi and blood, the vertigo is readily induced by fatigue. And in this case, it is usually accompanied by anorexia, lassitude, and pale complexion. If the spleen fails to transport and transform body fluids, endogenous phlegm may form, and so this will obstruct the middle jaw. This will lead to heaviness in the head, anorexia, nausea, and vomiting. If kidney essence is insufficient and the sea of marrow depleted, so meron pong aching weakness in the loins and knees, and tinnitus, in addition to vertigo. So in an obese patient with pale complexion, qi deficiency is common, and this is accompanied by phlegm. In a thin patient with darkish complexion, blood deficiency is common, accompanied by fire. Thank you very much for your attention. We'll now proceed to signs and symptoms. We call on Ma'am Vina Pascua to do the presentation straight from Baguio. Good afternoon, Ma'am Vina.
Good afternoon po ulit, Doctor, at good afternoon po sa lahat. Signs and symptoms, day 86 na po tayo at bluish-greenish philtrum and dark philtrum po ang ating topic. So sa bluish philtrum indicates internal cold, whereas pag greenish philtrum naman indicates a liver pattern, often stagnation of liver qi. Sa internal cold, bluish philtrum, feeling cold, abdominal pain, cold limbs, pale tongue, ang pulso po ay deep. Other symptoms and signs depende po kung saan at kung ito ay full o kaya ay empty cold. Din sa liver qi stagnation naman, greenish philtrum, hypochondrial or epigastric distension, irritability, moodiness, a feeling of lump in the throat, at nagkakaroon ng premenstrual tension. At ang pulso ay wiry. Then next ay dark philtrum, indicates chronic blood heat o kaya damp heat sa lower burner. Pag may heat naman in the blood, dark po yung philtrum, may skin rashes, feeling of heat, thirst, may bleeding na rin, mental restlessness, at pula ang dila. Overflowing at rapid naman po ang pulso. Then ang last po ay damp heat in the lower burner. Pag dark philtrum, yellow, itchy vaginal discharge, lower abdominal pain, dark o kaya cloudy po yung ihi. Ang tongue ay tongue with sticky yellow coating on the root. At saka yung pulso po ay slippery rapid. So yan lang po. Thank you, Doctor. Thank you sa lahat.
Thank you very much, Ma'am Vina. Let us now go to the last but not the least topic, BPH. And this will be presented by Ma'am Teresita Sumile. Good afternoon, Ma'am Teresita.
Good afternoon po, Dr. Hector and classmates. Welcome po sa benign prostatic hyperplasia is pathology. Day 2 na po tayo. Clinical note. Stasis of essence is a pathology that affects men and which occurs in genital manifestations. It is equivalent to blood stasis in the uterus in women. Stasis of essence is somewhat equivalent to blood stasis in the uterus in women, and its clinical manifestations in men are as follows: stabbing pain in the lumbar region, pain in perineum, hypogastric pain, pain in testes and or penis, then impotence, only some cases. Premature ejaculation, still only some cases. Then priapism. Prostatic hypertrophy, premature graying of hair, itching or pain in pubic region, abnormal sperm urethral discharge, Peyronie's disease, purple tongue, choppy, wiry, or firm pulse. A deficiency of the kidneys contributes to the development of stasis in essence and the accumulation of turbidity in the prostate. This leads to dampness and phlegm accumulating in the prostate. Dampness and phlegm in the prostate interact with stasis of essence, and these two pathologic conditions aggravate each other in the same way as phlegm and blood stasis do. In particular, when stasis of essence interacts with phlegm, it is a man's genital system that is affected. Blood stasis resulting from stagnation of liver qi and liver blood and from stasis of essence is another factor in the pathology of BPH. The clinical manifestations of blood stasis in men's genital systems are as follows. Stabbing pain in the lumbar region, pain in perineum, hypogastric pain, pain in testes and or penis, priapism, prostatic hypertrophy, abnormal sperm, blood in sperm, Peyronie's disease, purple tongue, choppy, wiry, or firm pulse. Blood stasis in the prostate occurs in the prostate's blood connecting channels. In treatment, one therefore needs herbs that penetrate the connecting channels like as follows. Classmates, pakibasa na lang po by yourself. Then, and now, Ju Lu is the pith of the red anchurin, the pith being the white fibrous tissue surrounding the flesh and directly below the skin of a citrus fruit. It is interesting to note that the connecting channels form a reticular network of channels, and the pith of the tangerine resembles such network. Before discussing the treatment of BPH, it is necessary to describe a pulse finding that is encountered frequently in practice. The prostate can be felt on the proximal end of the left ear, left rear position, that is left kidney position. This is felt by rolling the finger proximally, but only very slightly. If the prostate is enlarged, the pulse feels either slippery, indicating damp phlegm as the main cause of the swelling, or wiry, indicating blood stasis as the main cause of the swelling. So here is an illustration of a prostate pulse. So if the prostate is enlarged, as stated above, we can feel the pulse as either slippery or wiry. Now, if slippery, this indicates dampness or damp phlegm as the main cause of the swelling. And then if the pulse is wiry, then blood stasis or G stasis is the main cause of the swelling. Okay? Now, clinical note. The prostate can be felt on the proximal end of the left rear position, that is left kidney position. This is felt by rolling the finger proximally, but not very slightly. But only very slightly. If the prostate is enlarged, the pulse feels either slippery, indicating damp phlegm as the main cause of the swelling, or wiry, indicating blood stasis as the main cause of the swelling, as stated earlier. Okay? Now let's go to the summary. Pathology of benign prostatic hyperplasia. The pathology of benign prostatic hyperplasia is complex, and it is always characterized by emptiness and fullness. There is a kidney, spleen, and lung deficiency. dampness and phlegm accumulate in the prostate, and then stasis of essence or G. Also, there is blood stasis, and then manifestations are dampness, phlegm, stasis of essence, and blood stasis. Then the root cause is kidney deficiency, yang or yin, spleen deficiency, lung deficiency. Channels involved are governing vessels, directing vessels, penetrating vessels, kidneys, liver, heart, and bladder. Yun lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. I'm sure everyone has now the full grasp of BPH, benign prostatic hyperplasia. With that, we would like to thank everyone for joining, and we would like to express our heartfelt thanks to all the presenters. Good
Wala nga naman po.
afternoon, everyone. Thank you po.